they announced that Dr. Mahmoud would be able to run the facility while it was in bankruptcy court, and that the bankruptcy judge would have final say in who was going to manage the hospital going forward. He came to my office one day and said that he had some tangible evidence about some things that had been going on at the hospital. He was fairly determined for the city and the bankruptcy court to understand the truth about what was really going on. He did not want Mahmoud to have the opportunity to run the facility considering the things that he had seen. Now, after he left and I continued on with my risk rounds, and sometimes I was acting house supervisor, is when I was exposed to the things that I witnessed. One of them was the emergency room physician, and I do not recall his name, was literally there in the emergency room 24 hours a day. They'd get a patient and they'd wake him up, and they would batch patients and then wait and wake him up. And I was very concerned about that. I couldn't find any evidence where the physicians that were making rounds had been credentialed to be at our facility taking care of our patients. One of the nurses had some questions about some medications that she had gone into the pharmacy to obtain. She had taken telephone orders from a physician during the night, and she wasn't sure whether she was getting the right medications or not. And I questioned her further, and she said that they had left the pharmacy unlocked so that they could access the pharmacy at will. Regulations don't allow for the pharmacist, the pharmacist has to have complete control of the pharmacy, and you're not allowed to access the pharmacy at any time. It took place. She didn't feel comfortable talking about the fact that she had to go into the pharmacy with no pharmacist oversight or tech oversight or house supervisor. I did see him in medical records documenting. A lot of times he would take them into the doctor's lounge that was just the other side of the medical records office. My office was in medical records, and he would document on the record, which I immediately questioned because he is not a credentialed physician. He doesn't take care of patients at the facility. And when I questioned some of the other, the clerks and the coders that worked in medical records, they said that he was basically documenting things that would help the record to code a certain way. Even if he was clarifying some of the documentation and saying, if a congestive heart failure was a particular type of congestive heart failure, he's not allowed to do that because he's not the patient's physician. A falsification of record, especially if the particular person wasn't affected by the illness that he was documenting, not to mention that he was not a credentialed physician and was not physically seeing the patients. So I think they were looking at it both as a professional side and as a, personalizing it, that you wouldn't want some physician you'd never seen writing things in your chart. I don't think we have any idea what the full impact, how many patients' records that he's altered. I told them everything that had happened up to that point, including the fact that the ombudsman was escorted from the building without completing his survey. They were concerned enough that they in turn had reported him to the Attorney General's office and the Department of Health. I was very sad about the deaths and very relieved that the hospital had finally been closed. It did not surprise me. It was a big relief because it needed to have happened a long time before that. I do believe it's the lack of real scrutiny by the regulators. I think that I don't think that they want to be real punitive, because when you are real punitive, then it has a human tendency to cause people to not want to disclose. But there's certain ways that you can look at things that they just reveal themselves without a lot of effort. But you got to know what you're looking for.